Welcome back, everyone. Today, we're jumping right into a super focused explainer. We are going to unpack the core framework of Dr. Najib's renowned lecture on electrocardiography. You know, if you've ever stared at one of those scrolling, beeping monitors and just felt completely overwhelmed by all the data, well, you are in the exact right place. We're going to strip away all that complexity today and get right down to the absolute fundamentals. So let's dive right in. What does it actually take to truly master the heart? I mean, it's not just about, memorizing a bunch of random shapes on a printout. It's really about translating those invisible electrical signals that dictate every single beat. The source material we're looking at charts this very specific three-part journey that takes us from total confusion to absolute clarity. And the whole journey starts with the foundational science, electrocardiography. It's a huge word, but it's absolutely vital because before you can even think about spotting some subtle abnormality or making a clinical diagnosis, you've really got to respect the raw data collection. This is just the pure physics and physiology, literally capturing the heart's electrical current over time. Now, there's some fascinating dual terminology explicitly presented right in the source's title. Think about it. We have EKG interpretation on one hand and fundamentals of ECG on the other. Both of these acronyms represent the exact same vital medical concept, but it's really interesting how they're paired up. The fundamentals part, that aligns directly with the underlying rules and the basic physiology. Meanwhile, interpretation represents the active clinical skill of actually making sense of all that data. Which actually brings us to a really profound metaphor. Believe it or not, the literal auto-generated transcript provided for this specific lecture is incredibly sparse. It's literally just two words. English, English. Sounds weird, right? But think about what that actually represents. An EKG readout initially looks like a chaotic, totally foreign language. So the entire goal of this training is translation. It's about learning to read that complex electrical language so fluently that those squiggly lines basically speak to you in plain English. And getting to that point of translation relies on a highly logical progression that's built right into the lecture structure. Step 1 is the raw science, the physical recording of those electrical signals. Then, Step 2 focuses on the fundamentals. That means learning the normal baseline and the core rules of a healthy rhythm. And finally, we hit Step 3, which is clinical interpretation. That's where we apply those rules to actually spot things like arrhythmias or infarctions. You absolutely have to build from the science up to the rules before you ever attempt the clinical diagnosis. So the absolute crucial takeaway here is that mastering this skill isn't about rote memorization at all. It's about fluent translation. It's about taking those incredibly complex mechanics and turning them into actionable insights that can literally save lives. So the big question is, are you ready to interpret the language of the heart? If you keep this structural progression in mind, I